Welcome everyone. Thank you for joining us today. Today we're going to talk about a blueprint for strategic PMO success. I am thrilled to be joined by Scott Martin from Diversus Health, as well as our very own Florin Ungurianu. And we'll be discussing how you can really make your PMO journey a success with the insights that Scott's learned from multiple implementations here and really bringing his organization to the forefront of project management success with implementing a PMO for Diversus. So thank you so much for joining us. Florin, off to you.
Hi everyone, my name is Florin Ungurianu. I am the Senior Account Executive for the West Region. I'm excited to introduce Scott Martin, the Chief Information Officer at Diversus Health. Scott and I have worked together on structuring the project during the sales cycle. What I can tell you is that Scott and his team have been on an impressive journey to drive digital transformation and align their project and portfolio management with Diversus Health strategic goals. Today, he'll share some insights from their experience and talk about how they've elevated some of these initiatives in a constantly evolving digital landscape. Scott, I'll let you introduce yourself for everyone.
Excellent. Good morning, at least where I'm at, everyone. So I'm Scott Martin. I'm the Chief Information Officer here at Diversus Health, where we do substance abuse, mental health services for central part of Colorado. I have 30 years in IT project management leadership, all kind of combined in there too. Been at this organization for a little under 2 years. I don't care where we start this journey here. Been anxious to share my story with y'all today on how we implemented our strategic project management office.
Great, thank you. And I'd like to share just a few highlights or background information about this project. Before implementing OnePlan, Diversus Health operated in a lean Sigma environment, focusing mainly on efficiency and continuous improvement. However, as the organization aimed to elevate its technology and strategic planning, challenges arose in measuring some of those key metrics, project success, and aligning initiatives with strategic goals. Scott will explain in more detail their journey. But I believe that some of the key reasons that they selected OnePlan are listed on this slide. Flexibility being one of them. OnePlan offered the flexibility to accommodate, within one instance, different project methodologies for various maturity groups, including Waterfall, Agile, and Six Sigma. Integrations, so through our OneConnect platform, we offer a number of integrations. Specifically, Diversus Health was interested in the integrations with Teams, Power Apps, and Power BI, and obviously trying to extend the investments made in some of these existing tools. And simplicity, the clarity which OnePlan provided in creating or allowing the team to create this objectives and key results framework for the planning and measuring all levels at the organization. For those who are new to OnePlan, OnePlan is a strategic portfolio management platform that enables organizations to streamline their operations, optimize their resources, financials, and drive growth by investing in the right projects. OnePlan is a comprehensive all-in-one platform that brings together the strategy, portfolio planning, intake, financial planning, reporting in one place. Transparency in OnePlan is key, so as it helps organizations to make better decisions and visualize and aligning their strategic goals with everything that they're investing in. OnePlan is easy to use, is flexible, is highly configurable, allowing organizations to tailor the platform to the specific needs of and business processes. And it's also, like I said, easy to use. It is currently used by various organizations ranging from small startups to large and Fortune 500 companies, including IT, healthcare, financial services, and manufacturing. and also accommodating different types of functional groups within our offering. OnePlan offer a range of capabilities across the full spectrum, initiating, starting with the initiation, idea request, being able to frame or to configure an objectives and key results or any type of strategy framework, and then offering these capabilities across the full life cycle, starting with the planning, execution, monitoring, and analysis. We offer to OneConnect, like I said, a number of connectors. So we offer the flexibility to allow teams to still work in their preferred tools, but aggregating everything in one place for portfolio managers to visualize everything that is being executed across the enterprise. So that's about it from me. I'm going to turn it over to my team, and I wish you good luck. Thank you, everyone.
Thanks, Florin. Scott, thank you so much for joining us. I know you don't need any good luck because you've lived this every day of your life for the last few years. There's multiple things to learn here. So we'll get started by asking you how this journey began. You didn't have an SPMO when you got started. So how did you go from 0 to a fully baked SPM program?
Yeah, so it's interesting. The previous employer I was before I came to Diversus, we had actually gone through the sales cycle with OnePlan. So we'd done some due diligence prior to me taking this role. But when I came here, my role, of course, was Chief Information Officer. Starting a PMO or Strategic Project Manager's Office really wasn't on my job description, so to speak. Just so happened that the time I came into the organization, it was the last half of our fiscal year. We were closing out some projects, and just because it's a background I have, I was kind of noticing, hey, we're doing some great work here. People were really stepping up and learning. At this time, the Six Sigma is one of the project management expertises that the organization had for me getting here. But when we started reporting out on all this, I'm like, well, did we hit our goals for the year? So I started from the strategic standpoint, how well did we do? And we didn't have a great way of how we were measuring that. So the more you kind of uncover the onion, we're like, well, maybe there's a little bit of structure that we need to put in here before our next fiscal year. So I kind of went into at a PMO level of, hey, we need to organize our projects and make sure that we're getting the value from them and we're measuring and reporting them up. So our CEO, one of the best leaders I've worked with, great, it was a great choice to come here. He has great vision, great creativity. I kind of presented him the model that I was thinking of. We went back and forth. We kind of said, well, strategically, this is kind of going to help the organization move forward. So we kind of, did some brainstorming. Yes, the Strategic Project Management Office is probably the best way to implement this. So it was great. I have a great PMO background, but the strategic piece right there is my, I'll say, involvement has always been to enhance that strategy, if you will, or try to help build it. Not manage it, so to speak. So we went to work because we had a board meeting coming up. Our strategic planning kind of got shifted over to my office. So we need a methodology to kind of come up with. And the OKRs was the first one that I kind of researched. And I thought, well, this is good. It's very easy to use. I think it's very transparent, and I think it will be easily adaptable by the organization. So my executive team that I kind of inherited or came into, fascinating group of individuals, very caring, very open to change. So having their buy-in was great. I kind of presented as, I think this will work, right? Y'all been here for a little bit longer. And they liked it because it was measurable, but kind of gives us the stretch goals where we're trying to go through the future. So with their partnerships right there is kind of how we got from 0, getting stuff to the board for them to approve for our strategic directions, get those OKRs kind of defined. And then the other piece of the project management office of that, how do we get those projects or the initiatives, how you want to look at the work efforts, I like to say, measured up and going towards those projects. And we went through probably the PMO processes that you would normally do, how we prioritize that work, the scoring mechanisms, and kind of saying, okay, we have enough time, money, resources to do this block, and we moved on from there. Now, it wasn't perfect by any chance of the imagination. It's a learning curve whenever you're having something new come into an organization like this. But the communication and gaining the awareness, those that are familiar with the post-sky change management, that's the first step in that. So getting the organization aware of why we're changing and what we're doing. And I think it was received very well over time. We kind of got our feet under us a little bit better. We were tracking stuff, we were sharing that out. And the response was, yes, you're being a little bit more open with us. Even when we weren't perfect, and we had to change some of our key results, we were able to get the buy-in from our leadership team to kind of move this forward. And that was probably the most successful thing that we did right there, is getting everybody on board on that one, knowing while we're doing this change, this is how we're measuring, good, bad, or different, because part of the culture too, we wanted to kind of put that across the organization as well. OKRs we started with at the top level, just kind of cascading them down, and the laddering would come later on.
Amazing. So buy-in and communication were a really big part of the success of this program. What do you wish you would have known from day one that you learned throughout the journey? It sounds like you started off really well with a good plan for buy-in and communicating it out. Are there any things that you learned along the way that you want to share with people as being, some things to look out for?
Absolutely, because you learn more from what you didn't do or the things you did wrong before, right, going forward. So anytime you can share those out, it's great for anybody implementing something new. So when we were doing all the planning, right, for this at the strategic level for the OKRs, we did a great job there. But I knew I had to have some staff to kind of manage some projects and kind of do the execution of those, if you will. So we went into some staff needs. We posted those positions, and I thought we would hire them very quickly. So the idea was we'd hire the staff and start our implementation with the training for the configurations, kind of in a sequential order. It didn't quite go that way, right? Or some organization may already have those project managers and pieces to help with the configurations and implementations. The two experts we had were in Six Sigma, they were black belts, and they had just used spreadsheets to track their projects and how they were doing. So on the configuration on I'll say more complex and up-to-date applications such as OnePlan, they struggled a little bit, right? So I was kind of forced into kind of making a lot of decisions that I wished I'd had some staff already on board for to do that, if you will. Still worked out. It just I had to kind of pivot some of my time to help the configurations going forward, if you will. So have some staff in place prior to doing that. I have a great IT team here, but their specialties isn't in project management, if you will. So they helped on the configurations, and they did as much as they could to get it, the integration pieces going, the logins, everything else good. But when it came to how are we going to manage and run projects, if you will, too, that's where their skill set kind of went down a little bit there as well. So that kind of helped out quite a bit if you'd have those team members in place. The other piece is I'd seen OnePlan before, as I mentioned earlier in a previous job, but I had project managers that kind of did some of the due diligence, if you will. So when I looked at the program, I kind of understand how it worked and conceptually how everything mended together, right? But I didn't understand everything was a plan, right? So some of the things I thought would, cascade up from the project level to the strategic level, it's not how it was designed. So we did have to go back and do a little bit of, we'll say, changes to how we did our configurations. It wasn't a terrible lift or anything like that, because the system is very configurable when you go and change it. It was just, hey, if I'd seen a better demo or knew how this piece worked before I told you how to configure it, that would have been, a smart thing to do. But because it was so intuitive, it was like, oh, it's exactly how I think it works. So a little bit on that too is go through a little exercise on how it works and how the integration pieces work there to kind of get a full knowledge of the system before you start doing the configurations, because it'll make it just go a little bit smoother than the process we went through.
Perfect. So Lauren alluded to you starting with kind of a singular approach with more of the Lean Six Sigma methodology to managing projects throughout your organization, and you've morphed that into a more flexible approach over time. Tell me a little bit more about that process.
Yeah, so as I met our CEO, he's actually a master black belt. So he did a lot of trainings for 3 or 4 years before I got here on some yellow belt and some green belt initiatives, if you will. So the 2 black belts we had for running our bigger projects, if you will. But as I said, they know the DMAIC process pretty darn good. But there's other projects where it's not the best methodology to use. So in come the IT guy, right? So with the waterfall and the agile and the hybrids pieces, how are we going to integrate some different methodologies that may be the right tool for certain projects, if you will? And that was the benefit of kind of going at the PMO. We really don't care what methodology you use, right? We just want the best tool for the job. So how do we strategically put that into place to where putting the right people with the expertise on the right projects for a better outcome for the success? So we took advantage of the methodology that was already there, some of the training, right? And saying, hey, we're going to expand this out, right? Don't try to put that square peg in the round hole all the time. There's some maybe some better tools that we can introduce and use for these, right? So we kind of adapted what we had started with into different types of projects or methodologies to use for the types of projects that we categorized in the planning phases, if you will. And what was good about OnePlan there is it really didn't care that you were doing any type of methodology, if you will. We have different templates out there for a DMAIC process, an agile process, or a waterfall. We do have 1 or 2 hybrids out there that we do use for a few of our projects in this fiscal year. But that was the good thing about the application is it wasn't just built for that specific, we'll say, entity, if you will. And me coming from a big agile background, we had our tools where it was perfectly set up for an agile world. But if you tried to use a different type of methodology, it probably wasn't the best tool to be using, right? So we wanted to make sure we were flexible enough for the needs out there that the application can meet those needs as well. So that flexibility to we'll say, morph into or to take on a different type of methodology that would kind of help us get better outcomes was one of the strategic advantages we were looking for. Okay. One thing that we actually do as well, and this is, you can use epics in your program, stuff like this as well, but because we use our OKRs, there were certain types of projects that were, they're more work efforts. We call them engagements here. But it really didn't need the formal, we'll say, charter, if you will, and all the kickoff stuff like this. It's just a little set of work, but we did need some type of a plan to monitor it, make sure it's on track. It didn't need resources, pieces like that too. We call them engagements here. And let's just say it's a less formal project, but it's maybe a shorter time frame to get stuff done. And we didn't want to necessarily waste the time on doing the whole charter, which pretty much understood. Maybe it's calling 100 clients and getting this particular outcome or something like that. So we actually have an engagement template we use out there as well, instead of just the formal methodologies that we all probably know about as well.
Yeah, perfect. As a marketing person, I really appreciate the fact that we can create projects without having to have a fully baked portfolio all in place before we can get started. So what do you think are some key strategies for SPMO success, having gone from a system where you didn't have one to one where you're really successful and it's operating well? What are the things that you think were kind of the strategies that helped along the line there?
Yeah, so I think the first one, and for those familiar with the PMO, you can kind of configure to what the need is. Sometimes they're executing all the projects and kind of keeping track of them. Some of them, they're just there for guidance, if you will. So the first piece I'd have is really know what strategically you want your strategic project management organization to do. Now ours was pretty clear because we had a conversation at the highest level, which I totally say that's the first step, right? Get the buy-in, get what the value is, get why you're doing this, if you will. So that's kind of the first step to make sure you're not implementing the wrong solution, just with any project, if you will. And we wanted to know it was going to be our central hub. So no matter what project or who's doing it, report it up, and we can help measure it, make sure it's aligning with our strategic goals. If you need resources, money, whatever the case may be, then we can kind of pivot and kind of help that project make sure it has its best outcomes, okay? Over communicate the value and the vision. I remember because we kind of fast tracked this too. Every time there was a key 5 minutes at the end of a meeting, we have what's called our leadership where every month where we have a breakfast. So we kind of give topics of what's happening. Every time I had 5 or 10 minutes out there, I'd say, hey, this is why we're doing this. These are OKRs, right? Now, you can imagine it was probably new to some people and probably it was confusing at the first, but that's where the iterations come up there too, so kind of keep the vision and the communication going out there. So kind of eventually it'll stick, if you will. And that comes from the awareness piece I mentioned earlier too. This is a big change. It's probably going to be a big change for most organizations, especially if you've been in business for a while. Any type of change is always challenging. That awareness is the first key of why we're doing this, right? You can get to the other phases of it as well, but if you miss that step, try to go a little bit further, then the chances of it being successful, you know, are not as good. Okay, and then of course leadership support. Like I said, I had a great leadership team. They really supported this going out because we had never done OKRs here before. So getting, you know, behind a new initiative or something that may be a little bit innovative for us was key. There was really nobody that was fighting us saying, oh, this will never work or anything like that. They really saw the benefits, even though we weren't perfect at it, of, hey, these are measurable key results. Are we getting to those objectives? And then of course for us too, at the officer level, we're reporting that to our board of directors. So, you know, we want to be as honest as we can with our board if we're doing good or doing bad. It gave us some metrics that kind of say, hey, this is how we're doing for them too. And they appreciate that too on the transparency piece as well. Okay. And keep everybody informed. The more you can have the communications out there too, even to the lowest levels. We haven't laddered all the way down yet. It's something we're trying to do this year. But make sure that, hey, this is why we're doing this. This is where your work goes into, right? You may be seeing 100 clients, you know, a week or whatever. That goes to whatever the strategic goal that we're trying to do here. So that's kind of important too, that their work goes for some strategic value. The other one is start small and build. Okay, in the agile world, we call that the iterations. You may have a staff where you can take it very much all at one time. But I think typically something new coming out, a part of the functionality, start with that basics, so you can get up and running, that works, move to the other one. And that was good for us because there are a lot of new concepts coming to a lot of people that weren't familiar with some of the other project methodologies. It would have been almost overwhelming if we had done it that way for our team. Plus, we were building some team members as well. And if something doesn't work, then you can pivot and, of course, change that and do a little bit better. So that worked very well for us. And the last one is know the stakeholders and your personas, right? That's just with any other project as well. Knowing, you know, their tendencies, what's going to work, what's not going to work, where you have to spend some more time with these, you know, particular people or, you know, say departments, if you will. That will help out as well. And that's part of some change management, what we do on the project management level. And all those kind of helped us bring, I guess, a better successful rate than maybe we would have if we just said, hey, y'all are going to do this, right? We really got the buy-in and kind of as much as we could made people aware of the change.
Yeah, change management is a huge role in success in all digital transformations, and I'm not surprised to hear it was a very big part of why you've been successful as well. So OKRs, and in fact, we're getting a lot of questions about OKRs from the audience as well. So we might as well get to this next one. You implemented OKRs as part of the process. So how did that impact your organization?
Oh, so having not what happened the year before too, I'm kind of going to get the feedback and stuff like this just to be transparent, right? Coming into this, as I mentioned earlier, we had to kind of put a methodology to work, right? And when I went to say what's measurable for us, if you will, because that was really the objective we were going out there to. How are we measuring what we're doing, our success in the projects? Are they really moving our needle as far as our strategic goals, if you will? So I did, yeah, I will say it was some quick research, but the OKR methodology came up there too, and mainly because of the key results. You can measure what those are. it was very, for me, easy to understand, and I think that would be the easier thing for, if I can understand it, then my team's going to be able to understand it too. It was very, I'm gonna say easy to start, and I'll get into that in just a second. But the other piece of that too is you put stretch goals for your objectives. So it's the qualitative versus the quantitative, if you will, and it does both from the key results to the objectives. We really wanted to kind of make those stretch goals out there. Hey, we want to be the best organization for mental health in the state of Colorado. Now, how do we get there? What are those key results pieces? And our team could really kind of say, yeah, we do want to do this. Well, what is that work we have to do, right? So when we started that out, we'll say our key results weren't the greatest in the world. It was our first attempt at that. But we were saying, hey, we can measure these. Some of them, a lot of them were binary, if you will, too. We need to complete this or, see this many amount of patients. But we did a good start going out of the gate, right? The other piece that helped with that was the transparency. So we do our regular check-ins, and then we report out quarterly to the organization saying, this is where we are, right? Either good, bad, or indifferent is what it is, right? Either we missed here, this project is way behind, whatever the case may be, or the key results that are up there too. And that was very important because I don't think a lot of the staff here knew exactly where we were. It was just like, oh yeah, we're doing good. It was very, say, one-linerish, if you will. But having the values that we put there, because we score, of course, the key results, and we tell the people this is where we are on this. We're at a 30 here or a 70, whichever that is. And I think they appreciate the honesty coming from the executive level down there too as well. Regular check-ins make sure things don't go awry too badly. Maybe it was too aggressive, or maybe, hey, you know what, it was the wrong key result. We're not getting what we needed to. Let's change that, if you will. So being a little bit more adaptive or agile kind of has helped that out quite a bit. Because now at the quarterly level, we look at these and we say, these projects weren't important anymore. We had an issue a few years ago where we were changing some stuff into how the state was doing managed care or mental health care. And it kind of fell off. We didn't get the planning grant for it too, so we weren't going to move forward with that. We were able to pivot our strategic projects to say, oh, this isn't important anymore. These are, let's execute these pieces. So the agility kind of helped quite a bit. Implementing it across the organization, what I mean by that is the cascading down, if anybody's familiar with those terms. So from the top level, we're saying this is the work that needs to get done, right? And we're kind of cascading it down to the organization. The other part is laddering it back up where people, our staff members from frontline middle managers say, hey, no, these are some things we're seeing. We need to kind of ladder that back up to being a strategic objective. We've done a good job of cascading down. The laddering is still in process because it is important to know the work that they do, where it relates to the strategic vision, if you will. And that's hopefully on schedule to get completed this year. We're just in our first half of our fiscal year too. But as we move into next year's strategic planning, we're going to get the feedback from everybody in the organization to make sure the alignment is there. Because we haven't had that before, still work in progress, but we can see the light at the end of the tunnel now to kind of get those alignments between all levels of organization completed.
Yeah, that's a big lift, getting everyone aligned across the organization. I think that you did a great job at putting those high-level strategic overviews into place and then laddering that out to the organization. It's so important to have everyone be aligned on what the goals are at the very high level, and then working your way back down to making sure that the work that everyone's doing on a day-to-day basis aligns with those goals. That's a really huge objective, and big companies take quite a long time to make that pass. So congratulations on coming so far in such a short amount of time. That's a huge effort there. So appreciate your sharing that.
Yeah, one of the things to tell everybody too is I got a little taken back by it, but there's for John Dewar, Measure What Matters. That's the book I kind of used to kind of baseline it too. I took the course and got a lot of feedback, and I reached out to some professionals that done it before, and they were like, "You're not going to be perfect coming out." And I'm like, "What do you mean? I got to get this up and going, right?" They're like, "It's not going to happen. It's going to take time to build the muscles on doing your key results and the right objective, stuff like this." And it was a little bit harsh. I was like, "But it's got to be perfect, right?" So just remember, it's going to take a little time for organizations to get those muscle memories going through that too. And it was not too much of a downer because I wanted to get it perfect. But as long as you translate that to the executive team saying, hey, we went into it with our eyes wide open. We're going to get better at this, right? It doesn't seem like we were perfect with this, but over time, those key results are really going to come off the end of our tongue, so to speak, and it's going to be the right ones out there too. So just as a word of caution out there, don't try to make it perfect.
Yes, perfection is the enemy of good enough, right? Now everyone has some reading, a book club to read here too. So, it's always interesting to hear how people learn. We're not doing this all in a bubble, right? There's some great resources out there for people to, to learn more about setting objectives and measuring what's important. So, I'm glad that you shared that you did some research and brought that into the mix, because it's, nobody knows everything that you need to know from the start. You have to learn and continue to grow.
Right.
So speaking of learning, AI is a huge topic right now. It's so hot. Everyone is talking about it. How are you guys using AI and handling the use of AI in your organization?
Great question. And over the past year and a half, you're right, it's kind of the explosion thing. And I hope it's not just the keyword out there that everybody's using, right? But AI has great potential, especially in the healthcare area. We've seen kind of a rapid growth in what it can provide for the healthcare area. And it's not perfect, and there's still some concerns with it. But as I see it strategically, it's kind of here to stay. Now, how quickly it gets adopted and all the use cases, we can go into in a bit further. But our pilots, we kind of started small. One was in Sophia with the OnePlan with their PMO. The reason kind of why we chose this one is it was very knowledgeable to me, and we could kind of control the narrative, if you will. Hey, try this and see if it's going to help us do better objectives or key results, right? Can it create a better plan for us? What type of information can it feed us, right? It wasn't going out trying to get our data from our data warehouse or do anything like that too risky. It was just, hey, how are we going to get introduced? How can we use it? So our PMO offices use that in one instance. The other is our IT team uses it see how it can save on administrative time saved. So create this PowerPoint, write this email, summarize this, those types of things. We have a pilot just for our IT group, and again, it's a control group. We know that it's only using certain applications, not really getting any of our data out there too, because we're a HIPAA entity, if you will, for PHI. So it's nothing in that realm. It's just how are we going to do some efficiencies. And then recently we were able to get a grant. We're doing a pilot for some note taking for our clinical areas. There's several tools out there too that kind of increase the clinical time saved on writing their notes, because sometimes it can be very lengthy. You multiply that times how many patients that they see. It's a lot of time that can be saved. Where we just started that about 2 months ago. Doesn't have anything to do with diagnosing or anything with PHI. It's just how that note's going to get more efficient over time to help the clinician kind of make a better note and be a more efficient note, if you will, too. Because their time's critical. We want to see as many clients as we can. If we can kind of free up some of their time, then we get to serve more people in our community. So those are our 3 little pilots going on right now. And they are pilots right now, because one thing that we had to do is, of course, get your AI policy in place. And I recommend that for anybody, any governance area that you have, get them involved in that. Of course, in IT, we kind of started that cycle, if you will. But we have a HIPAA compliant officer that actually still reports to me. We have another compliance officer that looks at how notes are taking, making sure we're getting stuff done on time. And of course our legal entity as well. So we got them all to look at it, make sure they were okay with it, put it in place before we even start any of these projects, because if that's not in place, then people just want to, oh, give me an AI tool so I can do everything, right? And security is a big thing for us, and we knew we'd have to kind of do a little bit of security analysis and what we had to do to secure and label all of our data across the organization. It's kind of why we started with these particular ones. It was ongoing effort still going on right now. We're not to the point where we can say, oh, tell me how many patients I see or I've seen or anything like that too, because we don't have we'll say the AI safeguards in place. We do have access to the data that's in place, but how AI works, it doesn't really know that this is confidential information versus just, hey, this is the holiday schedule for your area. So that's got to kind of go through and kind of be vetted before we could do anything, we'll say large scale. But it's interesting when you ask that, especially in the healthcare organization. I saw a webinar just earlier today for this call. They have cameras in the operating room, and it kind of sees where clinicians are during surgeries, what instruments they're using, how they're using it, and it's all about patient safety, if you will. How are they? And AI is kind of looking and saying, hey, you dropped this, this instrument on the floor, and that's not good when you're doing a surgery right there too. And they didn't go into all the details about it, but that's how advanced this is getting. And the outcome is, healthier people, better outcomes for surgeries, for us, better outcomes for our clients as well. Do we get them quicker? Do we get them well quicker? And then again, if that's the case, we get them quicker, better outcomes for us, better services for our organization too. We're just kind of scratching the surface of it. There are some concerns out there, and they're valid concerns, right? But my advice out there is start a little pilot program that is very controllable. It is not kind of accessing any type of PHI data or PI data, anything like that, where you kind of see the benefits and see the uses of it too, because it's just not answering a question all the time. There is a lot of good use cases that we're using for it right now too. They're just at the small level right there too. We want to make sure people are comfortable with it. I hadn't heard this before. I went to a conference a few months ago that people were scared AI is going to take over their job. I never heard that before, but I can see it, but it's just a tool. It's not going to replace anybody. It's just another tool to help us be a little bit more efficient, or kind of help something that we don't see, if you will. But it was interesting. There's different perspectives on it at all too. So play it safe, start small, and then work up from there.
And put your policy in place. Everyone has homework. If you haven't got a policy in place, put your policies in place. Awesome. How does integration factor into the success of your SPMO? You talked about different types of waterfall, agile methodologies, Lean Six Sigma. How does that integration make your SPMO successful?
So when we went to a new application, and you can imagine one of our main tools is the EHR here, since we're a healthcare entity. Integrations are key, otherwise you don't really get the success for those. So we have integrations to our data warehouse. We write prescriptions. We send information off to the state. So it's a big part of what we do, and it takes away a lot of the manual efforts that normally would have to go with those. The same thing we had here when we look for a solution as well, and how we make that more, we'll say, noteworthy, if you will. So of course, the single sign-on is probably pretty big. We're big on that too, because we use multi-factor authentication, but nobody likes remembering 100 different usernames and passwords, right? And you can imagine healthcare entities like us, we have quite a few. So that's kind of a time saver. It kind of helps the frustrations for end users if they just sign in once and get to the applications they need to get into. So that was a big integration piece that we needed. We are a big Microsoft Teams entity. It's how we do our phone calls here. We kind of made that decision a few years before I got here to use that for our phone system for cost savings and efficiency. So integrating with a application that is very familiar to us, the adoption kind of helped out there as well. We use Power BI for our reporting structures, if you will, or dashboards. OnePlan integrates right in there to there. So it's a seamless integration of I can look at this particular dashboard, or I can look at my SPMO dashboard. So we tried not to change too much where we couldn't, but try to help the adoption rate for there. We use Planner and Project for the web on some applications too, and I know that's kind of new in this year too, so we're just kind of getting that kicked off. But it's a familiar thing that our users have seen, so that familiarity helps the adoption. And of course, my team too they're familiar with these tools, they support them every day too. So if there's a problem with some of these too, it's not a whole specific application we have to have support for. They kind of can learn and kind of adapt that to the applications and infrastructure that we already support. So it helps their learning curve too when we ever have a new application come into as well. We also use we don't have it integrated yet, it's on our roadmap. We use a Kanban board here for my department to track or visually track our work. We started that even before we started our SPMO. And my team likes it. It's very visible to every team member in our organization. It helps us track our flow, of course. It manages our work in progress. We haven't integrated that into where it kind of goes into our key results yet, but we're going to work on that too. And then one of our longer term goals is to use Viva goals to kind of do some OKRs at the team levels. And hopefully that cascades up and kind of helps the OKR adoption, we'll say at the lower management or lower levels of the organization. And again, the Viva stuff is familiar to our organization as well. So it's the familiarity to, and oh, now I can kind of adopt that a little bit better because I don't have to learn a new UI, UX. I don't have to have this username, password. And it makes the flow and then the time saved quite of a savings for us too, if you will. So we try to kind of take advantage of the integrations that are either there or can be done in the future to kind of help our staff work more efficiently, if you will.
So before we get to audience questions, are there any other tips or pieces of advice you'd like to give people in your role that we haven't talked about already?
Sure. And for those that are familiar with the project manager's office, been doing those for years and the strategic pieces there, get the buy-in from the executive level, right? Now, mine may be a little bit unique coming in as a CIO too, where the strategic planning is kind of underneath me as well. It's not always the case and doesn't have to be. As long as you have the communication between your executive team and know what the benefits of it are, right? Depending on what the organization is, and there's many industries out there too, and some probably a little bit more advanced. Some just may use one or two methodologies or the other, but really understand the value that the SPMO is going to bring, right? Because you just can't go do it and just check the check mark and say, oh yeah, we got a PMO office. You know, aren't we good? We're going to get all the benefits of it, right? I wish I could say it's that easy, but it's not. You do have to align it, and it does have to be, we'll say, a strategic piece in your organization, right? People have to know that this is how we're doing our projects, right? Where I've seen in my past, especially in the healthcare industry, you have some players out there too that was like, well, my project's most important. I want the money and the resources for mine, right? So, but the idea behind that too, I want all my projects done as well. But the idea behind it is to make sure you're doing the most strategic work for your organization. And that's kind of what it's designed to do. And taking the money and resources that the organization has and strategically placing those into the projects that give you the best chance for success that you're trying to get at. So make sure that's not overlooked at all, right? And it is going to take some buy-in from all executive levels too, because it's going to be a change. I hate to use that four-letter word, even though it's a five-letter word. It's a big change, and people may have to give up a little bit of control, maybe some of how they've done stuff in the past. But the idea is to make the organization better, change the culture a little bit too, because now you're a little bit more transparent, and try to make some of those goals maybe a little more strict. Now, we used OKRs. Not every methodology uses just stretch goals, if you will, there. But help get the best out of your organization, right? The other piece is don't try and rush the implementation. I know that everybody likes to check the check and get it done and move on to the next thing, but make sure you're getting those outcomes as you go along, right? Because doing it too fast, yes, it goes some time and budget and in scope, but did you get the outcomes that you wanted to? Make sure you're using some agility there too, so if something's not working, change it and make it right before you go into the next pieces of that. And I think that really helped us out too, that we did it in those stages. If we had done too much, I think we would have had a lot of rework in our particular implementation. So it's very much a very more methodical, we'll say agile way to go at it. And then having an application like OnePlan kind of helped out. A lot of people use spreadsheets. Like I said, we were using a little bit here, and I won't say I haven't used them in the past, right? But spreadsheet, it's a good thing to use if you don't have anything else, right? But having an application that can track all your strategic initiatives is gold for us, right? Because it's one source where we can go to and say, hey, how are these projects doing? Give me a snapshot of where they are. Do we need to put more time, money, resources or anything, or do we need to reprioritize, right? It's that one piece right there where you're not emailing a spreadsheet between all your executives or even sharing it out there. And it's flexible enough to where if you want to make those changes like us, we're using several different methodologies. It's not cookie cuttered into one specific, we'll say, industry or how you do the work. It's good enough to where it can change depending on what your needs are for it as well. Now it does do OKR, so it just happened it aligns with us maybe better than other areas or other organizations, but for us it kind of aligned very well when we went into the implementation phase of it.
Perfect. So I'm going to look at some audience questions here. We had quite a few come in. So we might have answered a few of these already, but I want to make sure that we address the questions the audience has given us. Obviously, they want to dig into your vast knowledge of data that you've got in your head about how to do this stuff. So the first question is about the portfolio prioritization process. How do you align business case benefits against the company's vision and mission and the long-term blueprint for your company?
Right. Okay. So, and this was it's kind of a near. If they've never gone through this exercise, it's a we call it a project prioritization training event here, and we've done two since I've been here. One I did last year, and this one we kind of engaged our director level too. Last year we just did it at the officer and the VP level. And you have to start about what's important. This is what we say. What do you want to get done this year? We'll start we do goals, but we'll start at the objective level. That's right. What are we trying to get done this year, right? And we start there. What's important to us, if you will, right? It's always good to ask that question, even quarterly. Okay, what's important this quarter, not just at the year, to set that in motion. So once we set that objective, okay, how are we going to get there? The next level on the key is the key results. Is how measurably are you going to get there? Now this is where it's easy to kind of default to the binary, like, oh yeah, we did this, so it's good. But if you really want to get control of this, if you're like, we need to increase our sales by 15%, well, you got to have that starting data, right? Which can be challenging, maybe depending on where you are in your data process, right? Because you have to have that baseline and know where you're going and how you're going to get there, if you will. Right. One of the things that Google uses, they wanted 1 million users by whatever time it was, and they tracked that over time. That was their North Star goal. And it took them a little while to get there, but they measured it over that time. So getting that data for your key results is key, right? And the entity here, if I understood the question correctly, is how do you align that accordingly? Your goals are going to change. Something's going to happen in your industry, no matter what you are. You may have to change those. We actually here have this year 6 main goals. Sounds like a lot. And our objectives fall underneath those, right? And right now there's certain objectives we are doing that are most important for our organization. Not saying we're not going to do some of the other projects and or objectives that kind of go right now, but we probably have 3 key ones that are the ones we're putting a lot of our efforts into, right? Because it's strategically good for our organization. It's good the executives are on board with that one, and you're actually cascading that down as well too. Is these are what's important, because as one of my goals or whatever, it may get on the back burner, but these are the most important for the organization. So making sure those are known, right? How you're going to measure those at the key results, and then if you want to use initiatives as kind of the nomenclature there for it, what's the work effort you're going to do to get to that key result? And it could just be one project, or it could be a number of projects, or some type of a work effort too. So making sure those work efforts and how you're doing that work to get to that key result, it should kind of ladder all the way up, that those are aligned, right? Now I could use some of the AI pieces right there because we're looking for efficiencies in those particular ones that I mentioned earlier, right? That's a goal of what we're doing, is getting more efficient at what we're doing so we can see more clients. That's the goal we're trying to get there. So making sure those alignments that are there and making sure people understand those, crucial, I'll say, for not even using OKR methodology, but for the strategic success of your organization. So that's how we kind of do it there too. How we do that is we get a list of 60 projects, by the way, and we have a criteria of how we score them. All of them are scored basically on 10 different formats, if you will. And we take that scoring at the end of that exercise and say, these are our most strategic values for these projects. And those are the ones we start picking off, right? Now, you're always going to have that one project that says, oh, we need to really get this done for a compliance reason, even though it didn't score as high. Or, hey, we got this grant, we got to use this money for something. Otherwise, you're going to have those one-offs. And that happens with every organization I've been in too. But the idea is to make sure those most strategic projects or work efforts are getting done first. It's just not, oh, I want to do this one because somebody's the CIO or chief medical officer or whatever, right? Because you're looking for what's best for the organization, not just your one department there too. And that's how our team works there too, is we kind of understand that those are strategic values. We may have a personal view, may not like them, but strategically it's what's best to keep us in business and see more clients.
That's a great answer to that question. I have another question about ROI. Have you been able to justify the ROI of this project? I'm trying to sell something similar, to OnePlan into my organization. So how do I go to my leadership team and deliver the value to the organization of bringing in a software platform?
Yes. So for us, I'd love to give you a great ROI answer here too, right? We didn't measure the ROI, and here's why. We really didn't have a great baseline to say, hey, this is how much, because we really, don't get me wrong, we did some training, we were doing some projects out there, but we didn't have a good baseline to measure ROI, if you will. We weren't spending any money on the software. We weren't getting any data about what we'd been done before, right? What we were seeing is there was an alignment issue, right? And I guess you could put ROI into it, but we didn't go into it with that as well. The alignment issue was, we're doing all this work, but are we achieving our goals? Now, I guess that could have been ROI there, but we really weren't checking the financials. But are we getting better at being able to report out how well the executive team is executing throughout the organization, right? It's a great question. We do ROIs at the project level, but for this particular one, it was probably in hindsight, it'd been great to go back and do it. But at the time, there wasn't the baseline we had there too. We were just trying to fill a gap. And we like to think of ourselves as a data organization. Part of the problem there was we didn't have the data to kind of say before and after. And for us, I guess we could have gone back and said, hey, we're going to spend some money on the application, some money on some new positions that we needed to execute this. Well, we could have seen some value out there too, but the short answer is we didn't. It wasn't one of the things we went into it doing. We're looking at the efficiency piece.
That makes sense. The next question is about governance. How did you plan governance, and how did you tie that into resolving risk and issues?
Okay. So the good thing, we have a lot of governance, as you can imagine, in a healthy organization. So we have some governance of HIPAA, how well we're doing notes. We actually have a compliance position here that looks to make sure we're getting our notes done on time, we get bills paid, as far as EHR and efficiencies of what we have to do compliance for the state. But our officer team does a lot of the governance. Even our board has overall governance for our organization too. We have committees that report up to the board. And in this particular case, for how we manage the projects, we do get an agreement from the board. We present them a strategic project plan every year. We don't go down to the project level typically. We give them our key results and our objectives, so they kind of know what we're going to do, right? Not necessarily how we do it. And we get the approval from them too, and they give us some guidance on, hey, what about X, Y, Z? We have a great board as well too. But when it comes to the governments, they actually have the superior oversight of that too. But we have different areas as far as projects. Typically our officer team, there's 5 of us that are kind of saying, yes, we need these projects, or we get an agreement before we go into, make sure there's no compliance issues or any gotchas, right, so to speak. Because when you're doing the project plans, maybe, hey, there's a budgetary piece we need to get approved first. The PMO will kind of put that up to the officer team, and we kind of govern, see how much money, what's the ROI on that one? Do we have the resources to do it? Does it even make sense to do it? Does it align with the strategic objective that we're doing at that particular time? So it kind of takes on some value there, but at the highest level, the officers have the control over the go forward or go not, or hey, we don't have the money for this, or can we get the money for this, right? Other stuff kind of filters to the PMO, and if there's anything it can't resolve, then the officer team, executive team kind of is the governing body to make sure the right strategic things are getting there. The PMO kind of just structures some of the work efforts from there or guidance from them to execute that during the organization. Now that can differ. We've done it differently in other locations I have. That structure just works best for our organization. We've had committees, not just officer teams, that have been part of that governance to say, hey, these are the right projects being done. And typically that's come from, in my past, is maybe you have a CEO that likes to do everything that he wants to, or the chief medical officer, doesn't matter what the title is. And the influence to get their stuff done first is always there, right? Because everybody likes to do their stuff. But having that government body kind of puts a little, hey, don't back end all these projects just because it's yours. Again, the idea behind that is do the most strategic things for your organization. Otherwise, you're going to miss the boat, and then somebody's got to answer for it, right? And the clarity and making sure everybody's on the same page, the transparency is almost gold out there too, to kind of help the culture of your organization, if you will. So we put a high stake on that too for our organization.
The next question relates a little bit back to the OKRs. And it's a long one, so you might have to go back and I can reread it if you need me to.
Okay.
How have you managed measuring project outcomes that feed to the same OKR, but they are across a portfolio and not necessarily able to show that they are causational to just the one change, because they might have multiple changes feeding into the measure or separate issues that impact the growth measure?
Correct. So interesting on this, we just started, we had one portfolio last year. This year we have two portfolios. Actually, we have three. One is manages our grants, by the way. The other one's isn't our strategic portfolio. It's what we call it our ancillary piece. And there's a lot of, I won't say it's strategic in value, but it's stuff we have to get done. But it does feed to our strategic values and how we're getting those key results, if you will. And a little bit this is in the effort of your key results. When you're going to do a project, you do have to do a little bit of due diligence. And let's say one of ours is we're opening up a new location to serve patients. Yes, that probably goes towards some compliance issues, making sure that those go into there. It could actually go into some of our digital transformation initiatives, objectives, right? The key issue there that we've said is, what is the project scope? What are you trying to do with this? What is the sponsor? What's the business case for it? That's a little bit on the sponsor's responsibility in our case to say, hey, yeah, I think this goes for multiple objectives we're trying to do. Then we kind of look at the key results and say, is that a measurement piece we're trying to do for this? Now, yes or no, it could be in or out of scope. And you may have to revisit those key results too. Does this actually help move it? You may have to change those, hopefully not add too much because you don't want to have too many out there as well. But strategically get the group to think, hey, does this move the needle on what we're trying to do for any of these objectives? And I wish I could tell you there's a little, reminder to say, oh, make sure you check those key results for other areas. Right now, it's kind of maybe the AI tool can kind of help with this later on. But right now, you just kind of have to say, hey, I know my objectives. Is this going to affect any of those other objectives or the key results we're measuring for those? And then either write those into a scope, maybe split it into two different projects if you have to. I think that's a bit more on the execution level and see how it ladders back up to those key results. We have a couple, we don't have a lot of our work efforts that kind of go to other objectives. We do have them. And we'll say we're getting those muscle memories to where we're saying, hey, this does affect different areas. Is it going to help move the needles on those two? So right now we're training ourselves on that as well, but right now it's very much of a manual process at this moment. If we get better, there's a new way to do that. But right now I suggest looking at those scope levels of the project and see, does that actually affect one of the objectives that you're trying to do, and then either adjust the key results or the project accordingly.
Well, we're at the top of the hour. I have one last question. I don't think it'll take very long if you don't mind. So how many projects are you guiding in parallel and how big is your PMO team?
Oh, so PMO team, we just lost our project manager. She is a stay-at-home mom. So right now, the whole people will say managing the projects are kind of helping other teams. We have 5 right now, but we do have other members in the organization that have been to some type of a project management training, whether it be on a Greenbelt for Six Sigma or some of the waterfall or agile methodologies we're teaching. So we kind of help them out, even though they're not full-time project managers. We do kind of oversight and kind of help them manage, run their projects. So we kind of do a dual role here too. Part of that was just the budget of how to build out that team. Over time, as budgets help, we'll probably add more project managers and team members to that too. But right now, we started with a small but agile team, right? And then we took advantage of some of the learning opportunities we're providing for our teams to kind of learn a new skill set. And it's been very favorable for our organization. A lot of people want to learn the Greenbelt on the Six Sigma side, and a lot of people have kind of said, yeah, this agile stuff or waterfall stuff looks pretty good. I think I can use it in my particular area. So right now there's 22 active projects we have going right now. And backlog's probably about that many right now. We've probably finished about 10 so far this year. And again, the numbers don't mean anything because some are more complex and take longer to do than others. But the idea behind that too is we have visibility into those, how we manage our resources to go to all these particular projects. Right now, when I first got here, my poor IT team, every time I saw them, go out, I was like, where are you going? Oh, we have a project meeting or this, whatever. They were on every team out there. I'm like, well, this can't work. We're never going to get any IT work done. So that's about the numbers we have there. We start off probably with 60 in the backlog starting out our fiscal year. Then when we started, allocating those out, some have more, of course, more people on them than others. Those are engagements as well. So I won't say all those are full blown, hey, this is how many charters we have for that. I'd say about a third of those are just smaller projects that we're just doing engagements with, where they're probably going to be over a lot, probably by the end of this year. They just didn't need the full scope of our project, if you will.
Well, I so appreciate we have more questions than we have time for. Obviously, your wealth of information, and I so appreciate you taking time out of your busy schedule to come and talk with everybody about your experience and share your knowledge and resources with them. Thank you to everybody who came to the webinar today, and I hope you have a great rest of your day. Scott, thank you so much. We really appreciate it.
Thank y'all. I hope it helped.
Right. Bye, everybody.